Well, welcome, everyone. I hope everyone's having a good summer. This is Scott Barstow with ACA's Public Policy Office. We might have a lot of people joining us, so why don't we go ahead and get started. And I'm actually going to start off by introducing a new staff member that we have. Jessica Eagle is her name, and she's on the line here, so I'll let her introduce herself.
Thanks, Scott. So as Scott said, my name's Jessica, and I just started about 2 weeks ago or so. I actually came to Washington, D.C. from Seattle, where I was in a middle school as a school counselor, and I received my master's in school counseling from Seattle U. Previous to getting into school counseling, I have experience working in issue-based and electoral campaigning, and I've actually worked in over 7 states, and all the campaigns that I was a part of were driven by grassroots strategies. So I'm pretty excited about this position and the fact that ACA is ramping up its efforts to represent and advocate for school counselors. And I'm excited to be on this call and start learning a little more about our members. And definitely feel free to contact me as things come up in the field of school counseling that I could be helpful with.
You want to go ahead and give your contact info?
I do. So that I'm just at the ACA number, which is 800-347-6647, and my extension is 202. And then my email is jeagle, just like the bird, at counseling.org.
Thank you. Yeah, we're very excited to have Jessica on board.
Yeah. It won't stop anything. It says it stopped.
Hello? What was that? I'm sorry. If you want to mute your line, you can do that by hitting *6, I believe. As I was saying, we're very happy to have Jessica on board. This is the first time that we have had one of our professional lobbyists actually have a counseling degree. One of the dirty little secrets of our office, and me in particular, is that when I started working for ACA, I had a bachelor's degree in math, computer science, and that was it. So now we've got an actual counselor working for us on policy issues, which is very, very helpful, obviously. Jessica will talk a little bit about some of the steps that we're starting to do here in a second, but let me start off by talking a little bit about some of the grassroots steps that we're doing now, and some of the work that we're doing with the VA as part of that. As some of you probably know, and some of you were probably there actually, we just at the end of July had our annual Leadership Institute and took about 130 counselors up to Capitol Hill, and they met with their Senate offices and their representatives' offices, and they were talking about the importance of supporting school counseling services and in federal appropriations and policy pertaining to the Department of Education. And we also talked about the VA and the need for the VA to hire more counselors, and people also talked about Medicare a little bit. Most of the attendees, well, I should say pretty much all the attendees are back home and have had a chance to share with us the feedback forms that they filled out on the visits that they had, and let us know the specifics of what the offices expressed interest in, what they said about the members' likely interest in getting involved in the issue. And we had some pretty good feedback, actually, and some pretty promising leads develop as part of the visits. Some of those contacts are still going to be bearing fruit as Institute attendees close the loop and follow back up with the offices here over the next week or two or three. But we already know that in Maryland, and we think also in one or two other states perhaps, we anticipate or have seen offices express interest in getting involved in the VA issue with us. We've drafted more communications for offices to send to the VA to try and nudge them to take concrete action to bring more counselors on board in the VA health system. Excuse me. And it looks like that's actually going to lead to some letters from one or more senators and perhaps representatives as well. We don't want to jinx anything by saying it's definitely going to happen, but so far things look good, and we're hopeful that will add a little bit more pressure and momentum to trying to crack the door open a little bit wider for counselors. If you're an institute attendee, or even if you're not, we would be very happy to work with you to contact your members of Congress specifically to try and get them interested in helping out by sending a letter to the Secretary of the VA, by having their staff make contact with local VA facilities or state VA directors. We can help draft any and all letters you might want to, or congressional offices might want to send on this. And there are specific things that we've been asking the VA to do to try and get more counselors on board. So if this is an important issue for you, please feel free to contact either Art Terrazas or myself. Unfortunately, Art's not in the office today, so he's not on the call, but I will gladly share his contact information anyway. Art is at the same 800 number that you probably most of you have used at one point before, 800-347-6647. Art's extension is 242. My extension is 234. Art's email address is ATERRAZ as in zebra AS @counseling.org. Mine is sbarstow @counseling.org, SBARSTOW. So if you're at all interested in contacting your members of Congress about the VA issue, get a hold of us, and we'll be very happy to work with you on that. The other issue that Institute attendees lobbied on was school counseling, and more specifically funding for the elementary and secondary school counseling program. It looks like that issue is at least going to be temporarily resolved when Congress gets back into session here after the August recess. Leaders in the House and the Senate are trying to reach agreement on a 6-month continuing resolution, or CR, as it's referred to inside the Beltway, which would fund all government programs at last year's funding levels for 6 months. And what that would do is get rid of or address the appropriations issues for fiscal year 2013 and for at least half a year. And that would be one less thing that lawmakers have to worry about and argue about and fight about and work on between now and the end of the year, when they're going to want to devote more of their time and attention to the budget sequestration that's scheduled to happen January 1st and the expiration of a whole slew of tax cuts that's also going to happen on that date. That's the kind of stuff that they want to devote their time and attention to, so this 6-month continuing resolution would free up time and energy for them to do that. Assuming that they're able to pass a 6-month CR, that means that next year, in the next Congress, we would be working with new members of the next Congress to try and resolve what happens for the next 6 months of the fiscal year. But at least for the first half of this coming fiscal year, funding for the elementary and secondary school counseling program would continue at current rates. Now, there may still be problems for current grantees who are hoping to get continuation grants, because if the Department of Education, and this is something that applies to other agencies as well, if it's known that funding may stop halfway into the fiscal year, that raises the question of, all right, well, we know we've got this much money that we can spend, but we may have more grantees out there that are expecting continuation grants, and we can accommodate with that amount of money. So federal agencies may hold off on dispersing money until they have a better idea of how much money they're going to have for the entire fiscal year to devote to various programs. So there may be some hiccups or wrinkles further along in the fiscal year, but we'll cross that bridge when we get to it. Since ESEA reauthorization isn't happening, and since we've got the 6-month continuing resolution, and we're hopeful that ESEA reauthorization and other bills like that will be coming up in the next Congress, we are focusing right now more on trying to get more ammunition, so to speak. We want to get more information from school counselors directly about how effective their services are, and build a stronger network of counselor advocates. And so that's something that Jessica's jumped in on and started up for us, and I'll let her say a little bit about how we're going about that.
Sure. So just what Scott was saying, we really want to start collecting stories from school counselors so that we can actually put them in front of public officials and decision makers when the time comes, and have some really powerful stories about what school counselors are accomplishing. I think everyone has gone, all our decision makers have gone through school and have had a guidance counselor and probably have their own thoughts about what guidance counselors and school counselors do, but that's not usually the whole picture. And so that's really what we want to be able to paint, a story of how effective school counselors can be and the great advocacy work that they're accomplishing in their schools. And so starting next week, as long as we get everything up on the website on time, we are going to have some links to a form that school counselors or others can fill out on behalf of a school counselor to tell a story about advocacy work that a school counselor has done in their school or in their community. We are going to then select from the stories that come in, we're going to select some of the most powerful stories that that come through and actually highlight them in the Counseling Today magazine, and as well as on our website and other communication channels that we have. And then we'll be able to actually take the magazine and the stories that come out of this and share that with our decision makers in district meetings here on the Hill, or whatever seems appropriate. And so what I think we could use help from the folks on this call is certainly getting that word out to school counselors that you know and that are in your network. This is an awesome way to have our members and to have school counselors in our community share their stories and receive some recognition for the good work that they're doing. And if anybody has a sense of folks that, or a network that we can share this call out for stories to, please just drop me an email, again at jeagle@counseling.org, and I can send you the email with the links and also kind of the explanation of what we're doing collecting these stories.
Could you do your email again, please?
It's jeagle, like the bird, EAGLE, @counseling.org.
And let me follow that with another request. We have seen one form from one of the Tricare regions, or one of the Tricare subcontractors, I should say, for counselors to use in becoming certified as able to practice independently under Tricare as as a quote-unquote certified mental health counselor. We would like to see more of these if people are getting them. We have not heard anything concrete from Tricare about what steps they're going to take to amend the interim final rule that they released at the end of last year. What we've heard is that at some point they are going to make some minor modifications, perhaps, to the regulations that they put out in the interim final rule. But we don't know what those might be. We don't know when that might happen. And it appears that Tricare contractors are starting to implement this now. The way the interim final rule was written, there are some significant questions about how exactly it's implemented that could have a big impact on counselors. We're trying to get answers to those, but since there's a paucity of information, I'll say, anyone who is a Tricare provider and has seen any of these forms or tried to go through this process, please feel free to share that information with me. So whether it's by email, email would be the best way. I'm sorry, say that again?
This is Dan Stacy. I've not seen the form, but people that are current Tricare providers in Illinois have received these applications to complete. And they ask for basically everything that a licensure application asks for.
It asks for everything but what?
That a licensure application would ask for.
Okay. The one that I've seen also asks for information regarding some of the other stuff that's in the interim final rule, including things like the 3,000 hours of postmaster's experience provided by a counselor, not another provider.
Right.
It lists the testing requirements, the education requirements. So if any of your providers would be willing to share some of the stuff that they've seen, I'd like to see it. Dan, are there any specific questions related to that process that some of your people have asked and got clarified?
No, they just wondered why they were doing, if they were licensed already in Illinois, why were they doing this all over again?
Yeah, that's a really good question.
Well, because 85% of the people licensed in Illinois won't qualify.
Right.
Oh.
Well, hopefully it's a little more than that, but
no, they won't qualify.
What was that again?
Because we allow so many other types of degrees other than a mental health degree, and because people weren't getting they get supervised by social workers, psychologists.
Yeah, the supervision hours one is going to be a big problem for a lot of people, I think.
Yeah. And that degree.
I don't think Tricare realized that when they wrote that in.
Yeah, only about 15% of the degrees here are mental health degrees.
So have any of your people contacted the Tricare contractor and said, look, my degree title is not mental health counseling, but it's community counseling, and it's really the same thing?
They're sending their forms in and seeing what's going to happen.
Okay. Well, please keep me posted on what sort of responses they're getting, because we'd like to keep tabs on this and try and help out if we can. I think a lot of this is going to play out at the contractor level and not necessarily at the national level with the main Tricare Management Activity Office. But if we can document some significant problems with this, and I suspect that won't be hard, we might be able to convince the main office to issue some sort of guidance to try and make things easier. The last issue I'll mention before we open it up to Q&A is the perennial Medicare issue. We still think that Congress is going to do something, probably in the lame duck session after the election, to address the physician payment cut that's scheduled to happen at the beginning of next year. We're not sure whether or not that doc fix package, which probably will be rolled up into one big, huge package that deals with sequestration and the expiring tax cuts. we're not sure if the Medicare portion of that is going to get into benefit improvements like expanding coverage to counselors, but as always, we would love to have more co-sponsors on our Medicare bill, S604 on the Senate side, and we would love to have a Republican House member introduce a House counterpart to that. We have met with a bunch of Republican offices and gotten generally somewhat positive, at least, responses, but no one has wanted to introduce anything that had a price tag associated with it. We have gone through some of the research on cost offsets of providing timely mental health care and what that means for reducing spending on physical health care services, particularly for people with a chronic medical condition and a comorbid diagnosis of depression. There are some significant cost savings that can be achieved if you provide services to treat the depression, and you'll save money by doing that by reducing general medical care use. We've highlighted those numbers when we meet with congressional offices, but unfortunately the Congressional Budget Office does not calculate those potential cost savings when it calculates the costs of enacting a particular piece of legislation. So it's an uphill battle, but we still have all the arguments on our side. So any constituent support and contacts that we can get to offices to get them to support Medicare coverage of counselors would be very helpful. So with that, why don't I open it up to Q&A or comments.
Hi, Scott. This is Rhonda Bryant.
Hi,
And
Rhonda.
I just wanted to say to Ms. Eagle, I'm sorry, I can't remember your first name. Is it Jessica?
Sorry, I was muted. Yes, it's Jessica.
Okay, Jessica. I'm in Georgia, and our Georgia School Counselor Association just had a major coup with our state legislature that resulted in school counselors' duties being changed, and also the number of students that we who we work with also reduced. So I'm wondering if other organizations or state counseling associations might have legislative advocates who we might contact who can help you in this kind of collection of anecdotal information.
That's a great idea. And, just coming from Washington State, I know that the WASCA has a lobbyist there, and so I will look into seeing what other states has had that force in their state and see what they have been working on. I think that's a great idea.
Thank you.
It'd also be great to get some more information about what exactly happened in Georgia. So
Yeah, absolutely. And Rhonda, are you a school counselor?
Well, I'm a professional counselor who works in schools, so some would call me a school counselor, yes.
Okay.
And I also have a background in mental health, so I'm active in both organizations. So I'd be happy to email you that information with their contact
I
information.
would appreciate that. Thank you.
Okay, thank you.
thanks, Rhonda. Anyone else?
I apologize, Scott. This is Rana from Illinois. I joined your call a little bit late. Was there anything, and I don't want to tie it up with recapping, but I missed the part about the VA, and we were really interested in that.
Sure. About the only recent news is that because of the visits up to Capitol Hill as part of the Leadership Institute, we have found a few more offices that have expressed interest in writing to the VA to try and get them to take action to bring more counselors on board. We haven't gotten any more letters sent out yet, but we've written up some more drafts and shared them with some offices, and hope that will lead to some more letters going out soon.
Okay. I know both Dan and I have started little Twitter campaigns on this issue as well. So
Great. That's awesome. We don't use Twitter that much. It's one thing we want to consider changing. So would it be possible for you to send us an email with some copies of some of those, just to give us a feel for what you guys have been doing?
Sure.
That'd be great. I appreciate that. Yeah, we need to think a little bit more than we have been about social media, definitely. Anyone else?
Yeah, this is still about the VA question. I'm Anne-Marie Bryant, and I do private practice, but I also do military family life consultant, which means I'm on the military base. And there's a need for more counselors out there in the community for VA.
Great.
Okay, so I know that, but I'm in a quandary because I was licensed in Kentucky, not under the supervised hours, like not 3,000. And then I have some hours of supervised, not 3,000. So I'm also licensed in Tennessee. So I really need to advocate as much as strongly as possible that we as counselors who are experienced like in the military need to also continue if we want to go in the community.
Okay.
We need the criteria. Okay?
Thank you. Appreciate that.
Hi, Scott. This is Kevin Medican in New Hope, Pennsylvania. I'm in private practice, but doing volunteer work with veterans on substance abuse and PTSD and raising awareness with families about recognizing those symptoms. And then what we do is, we refer them certainly to the VA for treatment. I'm curious, though, about how can LPCs in a private practice setting be of assistance to that population, if at all, through their insurance?
Well, it would depend on the insurance coverage. Excuse me. The VA, excuse me, does provide services directly through VA facilities, but also through vet centers and through working with contractors. What we've been focusing on primarily is the occupational standards and developed by the VA for LPMHC positions as paid VA staff.
Right.
And trying to get the VA to hire more LPMHCs instead of just a handful of LPMHCs and mostly the usual social workers and psychologists that they've been hiring for years.
Right.
I'm not sure to what extent VA facilities are looking for counselors to provide contracting services outside of the VA setting, and to what extent they're trying to work with counselors who meet the occupational criteria, or whether or not they're just looking for someone who's licensed and has some decent experience. I suspect it probably varies from facility to facility and state to state. But the best person to talk to about trying to see what that looks like and potentially change it if necessary would be Art, my colleague on staff here. He's the person that's taking the lead on the VA issues.
Right.
So if you have any specific questions or just want a status update, I would send him an email.
Okay, I will.
Hello?
Are veterans typically covered with Tricare? Is that as well after service?
Retired only. Retired only.
What was that?
Retired be under Tricare.
Right. Only about I think like a quarter of Tricare beneficiaries are actually active duty military, and or somewhere around that much. Most Tricare beneficiaries are dependents or retirees. So yeah, for retired service members, Tricare is going to be probably, I suspect there's probably more retired service members covered by Tricare than the VA, or that receive services by the VA, just because of the eligibility differences.
Thanks.
So yeah, the Tricare regulations are going to be pretty important.
Great. Thank you.
Hello, this is Lynn Santiago with the VA.
Yes, hi.
Hi, I am a licensed mental health counselor in Florida, and I'm an employee with the VA for almost 4 years. I did not graduate from a university that was KCREP accredited.
Right.
There are approximately 12 mental health counselors, licensed mental health counselors at our facility, which is actually a pretty large number of mental health counselors compared to many VAs. None of us are from a university that was KCREP. We are not qualified to apply for any of the mental health, the LPMHC positions.
Right.
The challenge that we have found, we have been approved to hire LPMHCs, and we have about 3 positions recently that were created.
Uh-huh.
One of them is in the team that I work for, which is suicide prevention. We had about 40 applications. Half of them were seasoned therapists. However, they did not graduate from a KCREP university.
Yeah.
About the other half were people who had just recently graduated, and they did graduate from KCREP.
Right.
However, we can't hire them because we do not have a LPMHC here to supervise them. So if you can see that there is a kind of built-in challenge, even with those positions that are now coming open, it's very difficult to fill them.
So the new positions the new LPMHC positions that they want to bring on, is it that the people who have the KCREP degree don't have enough supervision hours to be licensed?
The ones that have applied are, the way that the positions are, this particular position anyway was off, or how they're offered is that, for example, this one was a GS11 position, and for LPMHC.
Right.
However, it's also open for people who have just recently graduated who aren't licensed under a GS9, as long as they get licensed within 2 years.
Right.
So most of the, like half and half. Half of them came in that criteria looking to be hired as a GS9 without licensing yet. And the others were licensed mental health counselors who we couldn't hire because they did not graduate from a KCREP university, which is pretty much, again, everybody who already is here, licensed mental health counselors, don't fit that criteria either. So,
right. So it's kind of a catch-22.
Yes, it's pretty scary. Again, being here at the VA and really trying to advocate for mental health counselors, and at the same time realizing how limited I am here. I can't apply for any of the LPMHC jobs.
Right.
And then the ones that can, those that have received degrees more recently, and particularly those who may not be licensed yet,
yeah,
they can't get hired because there's nobody here to supervise them.
Right. So it sounds like the key to unlock this is finding someone who's fully licensed and who has a KCREP degree, and
right.
getting them on board. We've
Lynn?
we've talked to the VA about some of these kind of startup issues in the past, and just as an example, one of the things that one of our members heard when they wanted to apply for one of these positions or have one allocated to an LPMHC, the response they got was, well, there's not an LPMHC professional standards board set up yet, and we can't hire any licensed professional mental health counselors until there's a standards board, so you're just going to have to wait. And we talked to the VA about that, and they said, well, no, that's not true. Facilities don't have to wait until the standards board is completely up and running yet. In this situation, though, yeah, it would be nice, obviously, if they were able to find someone who met all the criteria, but we've been saying for a long time that the VA should adopt grandparenting standards, at least for this transition period, where they bring on people who don't necessarily have a K-CREP degree, but who are licensed and who are able to point to other qualifications they have that demonstrate that, yes, they know what they're doing and they should be able to work with veterans. You could set up grandparenting criteria along the lines of being fully licensed, having practiced for at least 5 years, having completed X number of continuing education hours focused on working with the military and working with veterans, dealing with PTSD, doing suicide prevention work, and a fully licensed counselor who met those criteria. You know, it's pretty hard to argue that they shouldn't be hired by the VA and doing this work serving veterans, especially if they happen to be a veteran themselves. I mean, we've had some of our members contact us and say, look, I'm a veteran and I know this stuff. I want to help my fellow veterans, and I don't meet the eligibility criteria.
Hey, Lynn.
So that's one of the issues that Institute attendees talked about when they did the lobbying visits here at the end of July. And we've asked the VA to adopt grandparenting criteria. They've said no. But if Congress wanted to, Congress could basically tell the VA to adopt grandparenting criteria, and they could tell the VA what that criteria should look like if they wanted to. So we would be happy to work with you to contact your senators and representatives' office to try and get them to make some inquiries along those lines.
Hello, this is Steve Wodzinski.
Yeah, hi, Steve.
I'm sorry, I joined the call late. I work at the VA in Tampa as well with Lynn, and I just caught the end of that conversation, and it sounds like then I guess we should be trying to work with our congressional reps and senators.
Yes. And we will gladly walk you through that and answer any questions you have about how to do that and what to say, and make it as easy as possible for you.
Yeah, that would be great, because I certainly agree with a lot of the things that you just mentioned about having qualified people in place, and in order to perpetuate people, LPMHCs within the VA, we kind of need to have some LPMHCs in place, and we're kind of going, we're here, we're ready to help, we're vets, we're whatever, we're licensed, we're so
yeah,
that would
that
would be great.
If you want to just shoot Art an email saying that you're considering contacting your senators and representatives about this and trying to help push it along a little bit, he can give you talking points and phone numbers and all sorts of stuff.
I'm sorry, who will we contact?
I'm sorry. Art Terrazas is my colleague here on staff at ACA who's taking the lead on the VA issues for us. and his email address is aterrazas, A-T-E-R-A, I'm sorry, A-T-E-R-R-A, Z as in zebra, A-S, @counseling.org.
Great, thanks.
Sure. Any other comments, questions? Well, if not, you know how to get a hold of us. We'd be happy to hear from you. Thank you all for participating, and have a good rest of the summer.
Thank you, too.
Thank you.
Thanks.
Thanks, Scott. Bye-bye.
Bye.
Bye.
Thank you. Bye-bye.